All right. Hello and welcome everybody. Thank you everyone for being here and for my final in my Developing World class. At the beginning of our class, each of us were assigned a certain country that we were adopted into, and I was lucky enough to receive the country of Laos, and I got to learn about Laos and all the different aspects of it, and I learned a ton. So here I will share a little bit about that with you. One of the first things I want to talk about is globalization. Globalization is kind of rated or scaled on like a 3-point system. You're 1.0, 2.0, or 3.0. 3.0 of a globalization, of a globalized country would be, a fully developed country that does international trades, international anything basically. A 2.0 would be kind of developing, still developing, not quite fully developed, still room for improvement. And then 1.0 is a pretty low standard of living. So what would you say, Jace, the United States would be on the 3-point scale?
Oh gosh.
Is it fully developed? Is it partially developed? Or is it a low
United
standard?
States?
The United States of America.
I would think that it's fully developed.
You're absolutely correct.
Oh.
Yes. There are a few of them, a few 3.0s, some 2.0s, and then there's a lot of 1.0 developing countries. Laos is a 1.0, so they're a pretty low standard of living on the development scale. Laos has a communist government, and they've been in power since 1975. The France absorbed Laos with Siam in 1893, and during World War II in Laos, the Thai Army and Japanese Imperial Army and the colonial French and the Chinese nationalist armies occupied Laos. So it's kind of a unique situation there, but a lot of French influence in Laos. So yeah. Okay, one thing that I also wanted to talk about were Millennial Development Goals. In 2000, in 2000, the United Nations decided to come up with some goals, and there's 8 development goals that were established, and they wanted to kind of help improve different aspects of countries and whatnot. Mm-hmm. So these are the 8 Millennial Development Goals. Number 1, eradicate poverty and hunger. 2, achieve universal and primary education. Promote gender equality and empower women. Number 4, reduce child mortality. 5, improve maternal health. 6, combat HIV and AIDS, malaria, and other diseases. Ensure environmental sustainability, number 7, and number 8, global partnerships for development. So these things have been slowly, some of them have been improved more than others in Laos. Some of them slowly, some of them pretty good, that they've been able to benefit Laos in their economy and just overall health and everything together. At the beginning of our class, my instructor gave us a dollar, gave us $1 bill, and gave us that bill with some certain rules that we couldn't spend the dollar right now or spend it on anything, and we had to come up with an idea of what we could use this dollar on, how it could help improve the people in Laos for whatever reason, or help but also helping us in some way. So it's kind of easy to think of things that could help them, different, anything that you could spend that dollar on, but it's kind of hard to think of what could help them and me spending this dollar at the same time. I've decided, I made a kind of an idea of what I could do with my development dollar that could be beneficial for both of us. So Laos is kind of a struggling country as far as healthcare goes. Mm-hmm. They don't have too many. They have a few like hospitals and nice clinics, but those are in the major cities, and all of these smaller cities that are roundabout have to travel either a long way to get to these hospitals, or they don't really have that much care real close by and immediate. So I was thinking, as my development dollar, I'm hoping to get into the medical field later down the road, that if I can use this dollar to help further my education, then I can pay dividends to Laos with anything that I can do, maybe trips to Laos or something like that, to help the overall health of, whether that's leading seminars or training or just volunteering my time to do that. But I would need to that help to get through the schooling so that I could do that. So that's what my plan is for my development dollar, and I hope that I can kind of help further the medicine and the healthcare there in Laos. Okay, so we have these millennial development goals. Partially they're being met, some more than others, like global partnerships for development in Laos. Global partnerships, that's number 8 development goal. They have a strong global partnership with an education that gave them a large grant for building schools and for children's schooling, like primary school and stuff like that. So it's been a huge really kind of blessing for Laos and their education system. So a question that could be asked is, what direction would I want the next United States president to take on global development for the U.S.? So what could the next United States president and the government do to help with development for the United States? The United States is doing pretty well, but something that I could think of is maybe working with, well, let me ask you, Steve, what do you think? What is something that you could see the president needing? You don't know? Okay. I think something that could be done is maybe the United States could work with smaller developing countries, like maybe improving trading with these smaller developing countries like Laos, because I think that could really benefit Laos for sure and help kind of bring up their development scale. And I think there's kind of strategies that could help the United States out with working with different smaller developing countries as well. So that's just kind of something I've been thinking about. In my field, in kind of the health field, there are definitely some innovations that could be beneficial for Laos. Jace, can you think of anything like, what kind of health, what are some things from the United States living here that you enjoy as far as like health and medical wise?
I think just the customer service that the nurses and the doctors give to all their patients. And
for sure.
I think if we maybe had other people from the United States go to Laos and, offer their services there, and maybe even build a better and cleaner hospital for these patients.
Definitely.
So that they're in a better environment.
Yeah, for sure. Yeah, that's really great. So in the medical field, there's some innovations that could possibly benefit Laos. Here's just a few of them that I found. So one's called the bubble CPAP. Okay, so this is kind of a airway device for children that you can get, or babies, that with newborn babies, it can kind of be a struggle sometimes for them to breathe because of the lack of medical care there in Laos. And so this bubble CPAP is an airway that goes and kind of directly down into the lungs to kind of help save them for babies that can't breathe and help kind of get the lungs moving and working. So that's kind of a cool one.
Yeah.
Another one is a leveraged wheelchair. Certainly there are people in Laos that need wheelchairs, but unlike the U.S. where we have nice sidewalks and paved roads, in Laos there's just dirt roads with rocks and stuff. So you can imagine how hard a wheelchair could be in something like that. So there's a leveraged wheelchair that you can use on these rough roads that kind of help maintain the terrain of these kind of unstable roads that they have in Laos. So yeah, I hope that this has been insightful. I hope that you both have been able to learn a little bit more about Laos, and I've enjoyed learning about it, and kind of been able to compare my standard of living and my life of living now and some of the things that people in Laos have to deal with. And man, you don't really know how good you have it until you see how poorly others have it. So yeah, thank you both for being here, and I hope you learned a little bit. And thanks again, Steve. Didn't say too much, but that's all right. All right. Well, thanks, you guys. Appreciate it.